So for this video, we're going to focus on the structures associated with the skull and not individual bones or sutures. Those I expect that you should be able to figure out yourself. Um, and so I want to focus on other smaller structures. So in terms of the smaller structures that are visible in this anterior view, there's a few of them. If we just follow along with our pointer right here, so this is the orbital margin right here. And so this is the supraorbital foramen, and this is the supraorbital margin. Inferior to that is the infraorbital foramen, and the term foramen means circular hole, so there's a circular hole there as well. And then inferior to that on the mandible is the mental foramen right here. So we have three foramens right there. Going back to the eye or the orbit right here, we have three more holes. Just going to rotate this skull a little bit right here. This hole right here is superior, and it's a crack or a slit. So it's in the eye orbit. So the total name of this is the superior orbital fissure. If you look inferior to that, you see this area right here. That's an inferior orbital fissure. And then not shown in this display here is the optic foramen, which is a small circular rounded hole in the posterior aspect of the eye orbit. So now if we're going to look laterally, we're going to look at a couple of things, a couple of bones here. The first bone we're going to identify here is the temporal bone. So this is the temporal bone and has several different important parts to it. The first part here is this whole structure, beginning with the temporal bone and then progressing anteriorly to the cheek. This whole structure is called the zygomatic arch. As far as the portion of the zygomatic arch that is found on the temporal bone, that's called the zygomatic process on the temporal bone. Inferior to the zygomatic process on the temporal bone is this rounded hole. This is the external acoustic canal. You may also hear me say the external acoustic meatus. Slightly anterior to that part right here, you see this little projection. This sharp projection is the styloid process on the temporal bone. And then posterior to the external acoustic canal is this large rounded process called the mastoid process. Continuing on inferior now, we're going to look at the mandible. The mandible, once again, we said that this was the mental foramen. This part right here is the body. And there's two major projections. Anterior on this projection right here, this part right here is called the coronoid process. The posterior projection is called the condylar process, Condylar. And between those two processes is this major notch called the mandibular notch. Now, if we progress to an inferior view of the skull, looking at it from an inferior view, we're going to take away this bone right here, which is the atlas. And then we're going to take away this bone, which is the atlas. So we just hid two bones. And now what we're going to do is to look for, we're going to hide a third bone, which is the hyoid bone. There's a paired projections that are part of the sphenoid bone, and this is the second time I've mentioned the sphenoid bone. The paired projections here are called the pterygoid process of the sphenoid bone, and those pterygoid processes are projecting inferiorly. So there's a pterygoid processes here, and there's pterygoid processes there. In addition, there's this very, very large hole right here. That large hole is called the optic foramen. It's part of the foramen magnum. It's part of the occipital bone. So this is the foramen magnum, part of the occipital bone. And then this is called the occipital condyle. So the occipital condyle is the structure that articulates with the atlas, which is inferior to the occipital condyle. And then the final structure that I want to mention right here is the external occipital protuberance.